Good morning, I'm Rose Lee, and Merry Christmas. This episode will discuss some serious issues like suicide prevention and depression in Florida, which is the 8th leading cause of death, as well as, according to the American Cancer Society facts and figures, in 2021, Florida reported over 4,000 deaths from colon cancer in younger people. And that could be prevented with screening. And did you ever imagine what life would be like living with a rare disease that impacts critical motor functions like walking or swallowing, though not affecting your brain? You'll meet these talented performers who live life to the fullest, all when we return. According to the American Cancer Society facts and figures, in 2021, Florida reports 11,220 cases, resulting in 4,360 deaths, all from colon cancer. And colon cancer is on the rise in people under 50 years old. However, according to a new Harris poll, 73% of surveyed adults 45 to 49 years old believe they're not at risk or at low risk for colon cancer. Colon cancer is one of the most commonly occurring cancers in both men and women in the U.S., and screening may actually prevent or catch the disease before it becomes too serious. Joining us this morning to help us better understand these rising rates and available screening options are two people with a personal connection to colon cancer. That's Dr. Angela Nicholas. She's the Chief Medical Officer of Einstein Medical Center in Montgomery, Pennsylvania, along with Scott, a colon cancer survivor and screening advocate. Good morning to both of you.
Good morning. Thank you for having us.
Good morning.
So tell us, Doctor, what do the majority of young adults in their 40s know when it comes to their risk for colon cancer, and what's their reality?
Well, despite the rising rate of colon cancer in young adults, most people do not recognize that they are at risk for colon cancer. There's just a lack of awareness about the risk. You are at risk for colon cancer and what we consider average risk if you are over the age of 45 and you have a colon. Again, 2/3 of women don't recognize that they have a risk. Hispanic adults do not recognize that they need to get screened on a regular basis. It really is a problem across the United States.
Although the incidence rate of colon cancer is rising in young adults, why do the screening levels remain low?
Well, again, I think most people don't recognize that they are at average risk for getting colorectal cancer. And you're at high risk if you have a personal or family history of cancer, have been diagnosed with a condition such as inflammatory bowel disease or Crohn's disease, or have other kinds of cancers that could, again, put you at higher risk. In addition, the age of colorectal cancer screening has been shifted, and I think that's causing some confusion. It used to be age 50, but the American Cancer Society and the United States Preventive Services Task Force got together, recognized that the age of diagnosis was actually shifting fairly dramatically to a younger and younger age, and so they made some decisions to move the screening age from age 50 to age 45 about 2 years ago. That, again, has caused some confusion. And so we're really here to talk about the fact that every American over the age of 45 that has a colon is at least at average risk and needs to get screened for colorectal cancer.
Is colon cancer hereditary, Doctor?
Colon cancer can be hereditary. There are some familial diseases that put you at higher risk or significant risk for getting colorectal cancer.
Since this has affected my family, we don't really know all the factors of why one gets colon cancer at an earlier age.
We don't. We think that, again, I think if you have a family history of polyps, you should understand what that means and then go and talk with your family doctor about when you should get screened. It may put you at higher risk, and you may need to start your screenings earlier, which it sounds like you understand that risk, so I appreciate the fact that you bring this up. We know that the American diet, the obesity epidemic has led to this. And in addition, we saw the decrease, the 90% decrease in colorectal cancer screening during the pandemic. So we've really got to get everybody back in the saddle again and really seeing their family doctor and making sure that they understand their risk for colorectal cancer and get screened at least at age 45. Don't put off your screening because of the pandemic. I think we know that COVID is here to stay, and unfortunately, so is colorectal cancer.
All right, Scott, tell us about your diagnosis and why you decided to get screened for colon cancer.
Well, I've always made health and fitness a priority, and I didn't have any risk factors. So when my doctor brought it up, I was a little bit hesitant. He offered up the Cologuard test, which was something I could do at home. It was during the pandemic, so they mailed me the test. I did it in the privacy of my own home. It's non-invasive. You mail it back. And I was shocked when I got the result. It was positive. Follow-up colonoscopy revealed a tennis ball size tumor in my colon, which they removed along with some lymph nodes and surrounding tissue. And a year later today, I'm cancer-free.
Wow, Scott, talk about a close call.
Yeah, talk about a close call, exactly.
Doctor, tell us about your personal connection to the issue and how it affected your personal life.
So my husband John was diagnosed at age 45 with stage 4 colorectal cancer. And unfortunately, he passed away when he was 50. He had a mission to make sure that everybody understood their risk and when they should get screened, and he's passed that torch along to me. I continue to do advocacy and make sure that everybody understands their risk and make sure that our medical professionals in our community are assessing our patients' risk. Interestingly, about 34% of Black Americans, while they're interested in colorectal cancer screening, almost 50% of our Black Americans have not been offered colorectal cancer screening. So make sure you go in there and talk to your doctor about your risk. It's really important.
Scott, given that colon cancer is the third most commonly occurring cancer in either men or women, what advice can you offer our viewers on steps they can take now?
Number one is to get screened. Talk to your doctor. Go to Cologuard.com. If you're 45 or over, you are at average risk. And if you catch it early, it's much more treatable. So just remember, the cancer doesn't wait. Age 45, talk to your doctor, go to Cologuard.com, catch it early.
Thank you, Dr. Nicholas and Scott, for joining us to help create awareness of the importance of colon cancer screening to prevent or catch the disease at an early age. Happy holidays to both of you.
Thank you, and thanks for raising awareness. We really appreciate it.
Thank you.
Listen up to how you can learn to take control of your individual or family health care plan to meet your needs in 2022.
What you need to know about the individual and family plans right now during open enrollment is open enrollment's begun. November the 1st, extended this year until January the 15th. If you need your coverage to start by January 1, please make your plan selection by December the 15th. Also, it's affordable. CMS just released a stat that 4 out of 5 shoppers after premium tax credit can find a plan for $10 or less a month. And at United Healthcare, we have also focused on making our individual and family plans affordable, focusing on parts of our plan design such as primary care copay physicians at very affordable prices, and some of them even complimentary up until a couple of visits, or prescription drugs, generics at $3 or less on many of our plan designs. If you are making a buying selection for the first time, it can be overwhelming. We'd love to help you. Please reach us at 1-800-806-0451 or at uhcexchange.com.
According to the American Foundation for Suicide Prevention, suicide is the 8th leading cause of death in Florida, with 63% of firearm deaths that were suicide. The holidays can be the happiest or the loneliest time of year, with high expectations, loneliness, and stress that can lead to the holiday blues. For millions of Americans, symptoms of depression can be a chronic position or severe and have a significant impact on all of the aspects of their lives. So how can we know the difference between a case of the holiday blues or something more serious? Joining us this morning to help us understand challenging signs and treatment options is Dr. Craig Chepke, board-certified psychiatrist and fellow of the American Psychiatric Association, along with Sally, a patient with treatment-resistant depression. Good morning to both of you.
Good morning. Thank you for having us.
Doctor, what is the distinction between clinical depression and the difference of a case of holiday blues?
Well, I'm really glad you asked. I always say that the holiday season is to a psychiatrist what tax season is to an accountant. It's our busiest time of year. And for some people, it might be a case of the holiday blues. But that's usually short-lived and not quite as severe as clinical depression, or as we call it, major depressive disorder. Major depressive disorder, it lasts longer, it's going to outlast the holidays, but most importantly, it has severe functional impacts and really has negative effects on the person's quality of life. So those would be the biggest differentiators I could say off the bat.
Dr. Chepke, what is treatment-resistant depression? And what treatment options are available?
Well, that's a really important question, and I'm glad you asked. We're really excited to have been able to partner with Janssen to bring this message and raise awareness about TRD. So treatment-resistant depression is when someone with clinical depression has not responded well to at least 2 different oral antidepressants. And that's actually not an uncommon situation. But several years ago, the FDA did approve a treatment option called Spravato. Spravato is indicated for adults with treatment-resistant depression or adults with major depression who have acute suicidal ideation, and all of it to be taken with an oral antidepressant. So just like all medications, there's different risks and benefits to treatment with this. And so what I'd urge everybody to do is if you think that you might be a candidate for this, talk to your doctor, because it's not going to be right for everyone.
Doctor, during the holiday season, we may have a friend or a family member that we know is going through some trying times emotionally. So how can we help them identify and evaluate the issue so this person with depression can find professional help?
Well, someone with depression might start to withdraw. They might start to not have the same performance level at school, at work, not have the same ability to participate in their house life or family life. And when someone just seems like they're not really acting like themselves, it's a good idea just to urge them to talk to someone about it. And I'll let Sally speak to her experience with treatment-resistant depression.
Sally, tell us about your experience with treatment-resistant depression, or as it's referred to, TRD.
Sure. So, for me, I really think that the main thing is that you can find there's the depression sort of brings on a lot of darkness or sort of a fog, and can make you kind of withdraw, I think, a little bit, and perhaps if that starts to happen to you, then maybe depression is starting to creep up. And I've been struggling with depression since I was in college. I've been managing it every day since then, just like diabetes. You manage it every day with exercise, with journaling, meditation. I try to make sure that I'm doing something to sort of manage my depression on a daily basis. But sometimes the antidepressant I'm taking seems to not be working anymore, or something like that. And that's when I've had to go to my doctor, which is what I did at the beginning of this year, and just say to him, this isn't working. I've heard about this new treatment, Spravato. I heard about it on a podcast. Is there something that I could be a candidate for? And so we spoke with the local clinic and were able to find treatment available for me. And I began that at the beginning of this year, and it's made a big difference for me. But, everybody's different. Depression is different for everyone. And I would say that if anyone feels as though that might be what they're dealing with, or if they have a friend or family that seems to be acting differently, help them make that phone call. Because sometimes when you're in the middle of depression, you can't make that phone call yourself. It's just really too hard.
Yes, and it's so important to recognize what we're suffering from. I have struggled fighting migraines and tried different doctors and numerous medications and then no medications. And I know when I'm getting my migraine. When I know what it's coming on, and I know the stress and the anxiety that's coming, and my neck aches, and I have an aura, like you said you experience, in my head. Describe your TRD symptoms.
That's very similar. It's a very similar in that regard. It just sort of feels like it's coming on. Sometimes it's obvious. Sometimes it might be precipitated by some kind of an event, but not always. And I think that that's the thing that to keep in mind is that it's not the same for everyone. And for one person, they might not be eating as much or not be so engaged socially, but for someone else, they may be eating more, or they aren't able to focus. And so it really is different for everybody. And so if you have depression, or you feel as though you're depressed or just not engaged in your life in the same way, make the phone call, ask for help. If you can't make the phone call, get a friend or family to do it. There are options, there is treatment out there, and I really encourage anyone to make that phone call if they need the help.
So tell us, Sally, how did you reach out and find your treatment options? And how has your experience with the medication impacted your TRD symptoms?
So like I mentioned, I had heard about it on a podcast that I listened to, and was sort of like, well, what is that about? And so I spoke to my doctor, who actually didn't know anything about it, and with his help, we were able to find a treatment clinic here locally that offered Spravato, and that's how I started, and it's been a great option for me. So I encourage anyone, if they already are on treatment, but it doesn't seem to be working, make a phone call, because there are other things out there.
Sally, do you think many people hide their depression and are ashamed of their mental state, or blame it on an emotional challenge like divorce, or hide behind the depression as they see it getting worse?
I think that could be what it is. But I really think I found early on in this treatment of depression that I started to look at it like diabetes or cardiac disease, which everyone is perfectly open about, and they talk about openly with their friends and family, but not depression, not mental health disease. And I think that we should try and take that stigma away, because there is no difference in diabetes or depression in how you manage it every single day. So if you need help, get help.
All right, doctor, where can we learn more about treatment-resistant depression? And also, guide our viewers to the resources for depression, since many people are suffering during this holiday season.
I want to thank you for having us here today. To find out more about Spravato, people can go to www.spravato.com. And also want to make everyone aware that the National Suicide Prevention Hotline, 1-800-273-TALK. And finally, urge everyone out there who feels like you're struggling, keep fighting, because there is hope and there is help. Thanks so much for having us today.
Thank you so much, Dr. Chepke and Sally, for joining us to create awareness of treatment-resistant depression.
Thank you.
Now, here's a quick reminder how to keep your health in check through preventative medicine.
Proactive prevention of disease is a function of both the primary care physician and the individual working together to ensure the individual stays healthy and has a good quality of life. Also, to identify the beginning of a disease, example, cancer, diabetes, heart disease. Early detection increases the chances of a complete cure or a maintenance program for the individual patient. To learn more on how to achieve a greater quality of health through preventive medicine, contact us at Infinity Healthcare Group in Broward at 954-586-8058. And please remember, January 1st is coming. You need to schedule your annual wellness exam. It is so important. It is the baseline of your health.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor. Most people never imagine living with a rare disease that impacts critical motor functions like walking or swallowing, but not how they think, learn, and build personal relationships. That's how life is for people with spinal muscular atrophy, or SMA, a rare progressive neuromuscular disease. As a caregiver to my father, a diabetic amputee, and my son with autism, I am a journalist and national disability advocate appointed by 3 Florida governors to serve the state for 12 years. Our federally mandated council helped create public policy to increase the quality of life for Floridians with disabilities. So I am delighted to introduce 3 talented members of the SMA community working to raise awareness, celebrate the true meaning of diversity, and showcase talented people with spinal muscular atrophy. Meet musician James Ian, lyricist and leading voice of Spaces, along with a cute married couple, Shane and Hannah of Squirmy and Grubs, a YouTube channel on life and relationships. Good morning, James, Shane, and Hannah.
Good morning.
Hello.
James, may I start with you? Tell us about living with your physical disability and how you use your musical talents to help others.
So I have SMA, and I'm a singer, a songwriter, multi-instrumentalist. I'm an actor as well. And I received my diagnosis of SMA around the age of 15. And I'd only seen, people with disabilities on TV just portrayed very, very negatively. And so I thought that that's what my life was going to be like, living with SMA. I thought I wasn't going to be able to socialize or find love or have fun and enjoy myself. And so I really just sort of, cut myself off from the world. And I just really leaned heavily on music, and music gave me an identity. It really gave me hope. And as I started to create my own music and write songs, I started to perform those songs. And in the performing of those songs, I started to talk about my life with SMA. And I realized that I could, represent people with disabilities authentically. I could raise awareness about SMA through music. And so that's the path that I've been on ever since.
That's great, James. We are all born with God-given talents, and we all need to pool our talents in many industries to get that diversity message out by sharing our talents. James, why did you decide to get involved in the project that created the song Spaces?
So 1 in 4 people in the U.S. live with a disability, and between 10 and 25,000 people live with SMA, and those are really, really large numbers, but we don't see many people on TV with disabilities. It's very, very rare. And in fact, when we do, they're misrepresented in negative ways. And so in partnership with Genentech and members of the SMA community, we wanted to, combat that narrative. And we wanted to show that, we have talents and contributions, and we're smart and funny and creative. And so we came together to create a first of its kind song project where the song was created and driven by people with SMA. And so I thought that was a really, really good way to get show our voices and to represent us in an honest way.
Shane, as an author, blogger, and speaker with type 2 spinal muscular atrophy, you're passionate about changing the public perception of people with disabilities. Tell us why you decided to start your YouTube channel and what type of content do you post?
Yeah, thank you. So I also live with SMA, and together with my wife, Hannah, we decided to make a YouTube channel about our relationship. People seldom imagine or see relationships like ours, where one member lives with a physical disability and the other member does not. Unfortunately, people that don't know us often perceive our relationship as bizarre or unrealistic. And I think that happens because there is this flawed and very damaging idea of what living with a disability is really like in our society. So we made videos about our relationship, our daily life, our adventures, our love, and our goal is to normalize disability and relationships like ours and show people that our love is no different than any other.
Yes, Shane, and that's a true statement of diversity in people. Hannah, as an interabled couple, you were involved in the creative process for Spaces. What do you hope people take away from Spaces?
Yeah, the goal of Spaces is really a very similar goal to the one for our YouTube channel. So that's one of the reasons Shane and I were so excited to be involved in this project. And we hope that people, take away the idea that disabled people are in all of the same spaces as non-disabled people. They're out there doing amazing things and living amazing lives. And we really hope that that message comes through in the song, aside from the fact that it's just an awesome song and James is an amazing singer. So we hope people love the song. They can go to spacessong.com to watch the music video, hear the song. It's also available on all of the major streaming platforms.
All right, Hannah, one more question. How did you and Shane meet?
Yeah, so we met almost 6 years ago. We were living like 1,000 miles apart, but I saw a YouTube documentary that one of my favorite actors had made about Shane on his YouTube channel. So I saw that. I reached out to Shane saying I had seen the video. It was about the nonprofit that he ran and the book he had written. And we started talking, then we started FaceTiming, and we fell in love very quickly.
Now that is a precious love story. Great job, guys. All right, James, share with our viewers the awareness message behind the song Spaces.
The meaning behind it is that we are taking up the spaces that non-disabled people occupy, but not only taking up the spaces, but really coloring those spaces with our existence and our talents and our creativity. And people should take note of that and consider us and understand that we matter and our lives are important.
Thank you so much, James, Shane, and Hannah, for joining us this morning to create awareness of living with spinal muscular atrophy as talented performers who share their abilities and live life to the fullest.
Thank you.
Thank you.
Thank you.
The holiday season is a joyous time with family and friends. So take a moment to be grateful and share your blessings with someone suffering from loneliness in your community. Reach out and make a holiday mark of kindness as we share our spaces together.
Things I want to do, I'm gonna make them true. My will is strong, I knew it all along. Don't try to box me in, I'm here to win. The life ahead, I haven't dreamed yet. I'm proud of who I am, no one I'd rather be. And I am worthy of anything and everything. I'm proud of who you are, who you're gonna be. And you will love the song that you're gonna sing.